Hello, everyone. I am Savannah Johnson, and I am doing my video on post-traumatic stress disorder and certain treatments that are associated with that. So firstly, according to Merriam-Webster Dictionary, post-traumatic stress disorder is a psychological reaction occurring after a experience that is highly stressful and traumatic, that is characterized by depression, anxiety, flashbacks, recurring nightmares, and avoidance of reminders of the event. PTSD was officially diagnosed in 1980 by the American Psychiatric Association. However, that does not mean that it wasn't previously prevalent. It just didn't have the official label on there. Originally, it was perceived that only those who served in the military would be exposed to such stressors that would contribute to post-traumatic stress disorder. For a while, there was a label of soldier's heart, or he was just like insane after men would come back from war with all of these signs and symptoms of today's diagnosis of post-traumatic stress disorder. Unfortunately, there would be decades before there was an official diagnosis that attributed their symptoms and later treatment options for the disorder. Today, it is known that any traumatic event can cause post-traumatic stress disorder, such as a terrorist attack, catastrophic weather like Hurricane Katrina, volcano eruptions like just happened in Hawaii, or various forms of assault and abuse that are also prevalent today. In order to be diagnosed today, there are multiple criteria that have to be met in order to be clinically diagnosed with post-traumatic stress disorder. Firstly, a traumatic event has to have had occurred, and then a combination of 6 other symptoms must be met. Today, there are various treatment options from multiple forms of therapy, like play therapy, talk therapy, all sorts of types of therapy to use. And you can also do that with combination of medications. Both therapy and today's medicinal options take months to regulate and control the symptoms. They are a very slow process in working to either manage symptoms or rid of certain symptoms overall. There are very few natural alternatives to the medicinal approach. However, a few are being researched. One of the more recent research efforts are looking into psychedelic drugs, such as the psychedelic mushroom, which contains psilocybin. While there has been a little more leadway made available for research in the psychedelic mushrooms, it is still strictly regulated by the FDA and the DEA. So while there's been that little wiggle room, not much progress has been made for an official treatment option just due to all of the barriers. But it is a good option for chronic post-traumatic stress disorder, as research has shown. It's been shown that psychedelic mushrooms, that while potent, if taken in large doses, is relatively safe, especially compared to other pharmaceuticals that are out there today and being currently used. A clinical trial showed 63.6% of users noticed positive improvement to their conditions over 6 months of use within this trial. There was an overall trend of decreased psychological distress and suicidal thoughts in those who participated as well. The next step is trauma-focused exposure therapy, which is where a normal therapy session is taking place, but the patient is also under the influence in a small dose most of the time. In the research that I've seen, it's been like micro doses. So they're sort of feeling the effects, but they're not completely lost in the psychological aspect of the drug. It's mainly just to help them move fluidly through their thoughts versus get hung up on a certain aspect that will prevent them from progressing in their treatment. While this is still being studied, there are countless hurdles with research in bringing access to patients diagnosed with chronic post-traumatic stress disorder. That's important. This isn't just for anybody's diagnosed for post-traumatic stress disorder. This is mainly those with chronic, which is where they experience the symptoms for longer than 3 months at a time. The DEA and the FDA they're on two different pages with how to regulate this drug and approve access for it. There's a need to reconsider the hard restrictions on the substance and for them to look into how useful this could be when properly administered in a clinical environment. Comparatively, there are little side effects versus other pharmaceuticals that are used to regulate post-traumatic stress disorder symptoms. Other drugs can actually increase suicidal thoughts or harm towards others. That's a huge thing on all of the labels. And it can also have adverse effects against other organs within the body. Like some can cause liver damage, some can cause kidney damage. All of that is not exactly a positive to regulating PTSD with these prescriptions. The effects of psychoactive mushrooms or psychedelic mushrooms are temporary, no matter the amount administered. There has not been a case that we have found during research where the patient has not been able to come out of experiencing the drug and the hallucinogenic effects. While there are recommended amounts to consume for this kind of therapy, if an overdose is in effect, there are no lasting effects. And so that doesn't pose a risk for further harm. This concludes my discussion on post-traumatic stress disorder. Hopefully it has proven to be beneficial and increased awareness on how psychoactive substances are not always what they are made out to seem. We've grown up where things like that are very regulated. Like once you do something like psychoactive mushrooms, they have negative effects against you for the rest of your life. That is not always the case in these studies. They actually help those diagnosed move forward and live healthy, normal lives. There are true benefits of properly using these substances with very little to no adverse effects. So, according to all of the research that has been allowed to be conducted to this day, there is a movement where they're trying to get the FDA and DEA to reevaluate their restrictions. Thank you for your time.